Hello, everyone. I am Dr. Tawab, co-chair of ISPRM Communications Committee. And as the days of this year's conference in Vancouver are getting closer, so is our excitement for the conference as well. And today I have with me Dr. Eleftheria Antoniadou, who is one of the keynote speaker who will be talking about aging with disability on 20th of May from 8 a.m. to 8:30. And as I try to get a bit of sneak peek regarding her keynote lecture, I want you all to join me today. Hello, Dr. Eleftheria. How are you doing today?
Hello, I'm doing very well, thank you. And what about you?
I'm doing great, and I'm really excited for the upcoming conference.
Me
And
too.
speaking of which, I would just try to get a little bit pieces from your upcoming keynote lecture. So, as you know, that many people now live longer with lifelong disabilities. So, what do you think that what are the most important challenges that emerge when disability and aging intersect with each other?
Uh, when disability and aging intersect, the key challenge is the accumulation of vulnerability over time. People who have lived for decades with a disability often reach older age with lower physiological reserve. Why? Because of the aging process adds with the geriatric syndromes and like sarcopenia, frailty, multimorbidity, and the functional declines can be accelerated. So here it is important to understand the differences between aging with a disability and aging into disability. And although this is there are very common trajectories on the end, they are different things. When you age into disability, we talk always about these geriatric pathways that the disability appears later in life. Whereas when you're aging with a disability, you already have been disabled for most of your life. But although they're different, as I said before, later in life they converge. And both of these challenges, they have functional needs, complex functional needs. And what is the problem here? The problem is that our healthcare systems are focused mainly on disease and not on function. And they're usually not good on meeting the functional needs of this special population.
So you have highlighted a very important point here that uh, the loss of, you can say, the lack of focus on the functional needs of this patient population. And that brings me to my next question, that keeping in view this thing, what do you think should be the role of rehabilitation physicians in ensuring that people aging with disabilities maintain their independence, participation, and quality of life?
Well, rehabilitation professionals are key players here. You can understand that. Why? Because they focus on function. The goal is not only here to treat the medical condition, of course, it's to help people move, participate, and remain independent in daily life. This requires lifelong interdisciplinary approach, no? Well, rehabilitation supports mobility, prevents avoidable decline, adapts environments, and also care strategies. So can people live their meaningful lives and independent lives.
That's great. So, looking ahead, so what innovations, whether they may be in technology or in care models or some policy, give you the most hope for improving the lives of people aging with disabilities?
You see, there are several developments that are very promising. The first one is AI technologies. Why? Because AI will help us process big functional data. And this data will help us, of course, prevent, uh, um, be able to really detect early disabilities or early declines and make more personalized functional programs and rehabilitation protocols. And of course, will help clinicians with decision making, help support, not be in the place of the rehabilitation physician. It's usually there. The second one, it is the digital health tools. They're very important. There are these wearable sensors, or they are the telerehabilitation platforms and the most advanced technological assistive technologies. All of which, what they do, they help people maintain mobility, function, independence, and safety in their living environment. The third, and to me are very important, is the shift towards the integrated care model in the continuum of care. What do I mean by that? Rather than treating health episodes, health problems like an episode in the person's life or in the healthcare, this model connects prevention, acute care or medical care, rehabilitation, and community settings in the lifespan. So the rehabilitation is not only one moment, but it starts in early functional monitoring. It goes to acute medical rehabilitation, to post-acute, to subacute, to long-term functional, and to, of course, community-based support services. In this model, the focus is not just to recover the recovery. It is to maintain function and to participate over time. So, all these three is very important. Innovation will help us shift from a reactive healthcare system to a proactive healthcare system, where function is the center and participation, it is also the goal.
So I, for one, I'm really excited for your upcoming keynote lecture on aging with disability, and I hope to see you soon in Vancouver. And for the audience, I would like to mention that the preliminary program is out now, and now you can even register for the pre-conference workshops that are going to be held on 16th and 17th of May. So just go to ISPRM 2026 and book your spot. Thank you so much, Dr. Eleftheria, for joining us today.
Thank you. See you all in Vancouver.
See you in Vancouver.